Hello and welcome to the objective of describing the systemic effects of inflammation. So we already know that inflammation can manifest both locally and systemic, and thus it has local and systemic effects. For the local effects of inflammation, we have already talked of redness or erythema, where there is inflammation at the site of injury or infection, leading to increased blood flow, causing the area to appear red or flushed, and this is due to vasodilation and is a localized response. Number two, we had talked of swelling, which is edema, so that localized inflammation can result in swelling as blood vessels become more permeable, allowing fluid, proteins, and immune cells to accumulate in the affected tissue. We also had heat, or also referred as calo, where there is increased blood flow to the inflamed area can make it feel warmer to touch. So this localized heat is as a result of the body's effort to deliver immune cells and nutrients to the site. We also have pain, that is dolo, and inflammation often causes pain or discomfort at the site of injury or infection. This can result from release of inflammatory mediators, pressure from swelling, or stimulation of pain receptors. And lastly, we talked of loss of function. So depending on the severity of the inflammation and its location, there may be a temporary or even prolonged loss of function in the affected area. For example, the joint inflammation can lead to limited mobility. And lastly, we have tissue damage, where inflammation can, if it's severe or chronic, it can contribute to tissue damage or destruction in the local area. This can have long-term consequences if not managed. So after looking at those six local effects, it is now time for us to look at the systemic effects of inflammation. And the effects of inflammation, we start with fever or pyrexia. And this is one of the most recognizable systemic effects of inflammation. So when the body detects the presence of pathogen or inflammatory mediators, it normally releases cytokines. And these cytokines are interleukin 1 and interleukin 6, which normally act on the hypothalamus to raise the body temperature. So fever is normally a defense mechanism that helps enhance immune function and also inhibit the growth of some pathogen. Number two, we have acute phase reaction. And this one is normally made possible by the liver, whereby the liver plays a crucial role in the systemic response to inflammation by producing a group of proteins known as acute phase proteins. So these proteins include the CRP, we call it C-reactive protein, and serum amyloid A, SAA. Okay, so these proteins increase during inflammation and also serve as markers of acute phase reaction. So they help with various aspects of immune response, such as opsonization. And opsonization simply means marking pathogen for destruction. They also help in promoting inflammation and modulating the immune response. Leukocytosis is the third systemic effect, and in response to inflammation, the body may release a high number of white blood cells, the leukocytes, particularly the neutrophils in acute inflammation and macrophages for chronic inflammation. This increase in leukocyte is known as leukocytosis and is a common systemic effect of inflammation. A link will be popping up for the 7 steps of leukocyte recruitment. Number four, we have increased heart rate, that is also tachycardia, where inflammation can lead to increased heart rate, that is tachycardia. And the essence of this is that it is part of the body's effort to pump more blood, okay, more immune cells, and more oxygen to the site of inflammation. We also have changes in blood vessels. So systemic inflammation can cause changes in blood vessel function. So when you have the inflammatory mediators, they normally lead to vasodilation, which helps increase blood flow to the inflamed area. However, it can also lead to increased vascular permeability, allowing immune cells and proteins to exit the bloodstream, that is intravascular space, and reach the site of infection or injury. We have decreased appetite or anorexia. So during systemic inflammation, you find that the body may reduce the appetite as part of a protective response. This reduction in food intake is thought to help conserve energy and redirect all resources and energy towards the immune response. We also have fatigue and malaise. Inflammation leads to feelings of fatigue and weakness and malaise. This can be attributed to the release of pro-inflammatory cytokines that normally affect the CNS and the overall energy levels. We also have the muscle and joint pain. Okay, remember the other name for joint is an arthrosis. Okay, a link will be popping up for the different types of joints. So systemic inflammation can cause muscle and joint pain. So when you have the muscle pain, we call it myalgia. And when you have the joint pain, we also refer to it as arthralgia. So these symptoms can be associated with conditions like viral infections or autoimmune diseases. Um, we also have the systemic effects. In other systemic effects include alteration in blood chemistry and impaired organ function. So you find that inflammatory mediators can influence blood chemistry. For example, they can lead to changes in electrolyte balance, which can affect various bodily function. In some cases, chronic inflammation can lead to organ dysfunction. For instance, a systemic inflammatory response can affect the cardiovascular system, respiratory system, even central nervous system, potentially leading to organ failure. So those are the different types, or those are the different systemic effects of inflammation.